We have some troubling news about treatment for advanced ovarian cancer.
More than half of the women who could get a life-saving treatment for the deadly cancer are not getting it. CBS 2's Dr. Max Gomez here with this story. Doc.
That's right, rather Maurice and Diane. Ovarian cancer is deadly because it causes few symptoms early on, so it's often at an advanced stage when it is found. That's why there are 14,000 deaths from ovarian cancer every year. But a special double dose of chemo could help significantly. While battling ovarian cancer, Terry Winsek's backyard was her sanctuary. Diagnosed at stage 3, she took comfort here as she braced for a long battle with cancer. But just a few months after treatment began, her doctor had good news.
At that point, he said, yeah, you know, it looks like everything's good. I mean, officially in remission, as much as you can say that, and just continue to check up on things.
What helped make the difference for Terry was a double-dose approach to chemotherapy. Not only do patients get an IV dose, but also a follow-up dose directly in the abdomen. A new study shows this dual approach pushed the 3-year survival rate to 81% in advanced cases, a 10-point jump. The bad news? It also found that at 6 of the largest academic medical centers, only 41% of women got it.
Why are there such wide variations at large academic National Comprehensive Cancer Network hospitals in what is probably the best therapy for patients?
Ovarian cancer often spreads by direct contact with abdominal tissues. This treatment, called intraperitoneal chemo, bathes everything in the abdomen to try to kill any microscopic metastases. The technique was first studied a decade ago, and today half of all patients who got it are still alive 10 years after diagnosis.
Not that long ago, less than 1/2 of women who are diagnosed with advanced ovarian cancer were alive only 2 to 3 years. That's why it's so important.
One of the reasons the approach may be underutilized is because some patients may assume more chemo means more side effects, which isn't necessarily true.
It makes sense. I mean, to think like you put the chemo right into where the cancer was. I think that's just brilliant.
Now, the dual chemo approach is used after surgery in advanced ovarian cancer. And even though side effects can be worse with this technique, not always. And some modifications in the abdominal chemo can lessen those problems. Some patients say the side effects are worth the increased survival.
Okay, Doc.
Dr. Max, thank you.